This is advice for patients who have problems while their child is wearing a Biobloc upper stage 1 appliance. It is a very reliable appliance and it's used all over the world, but like anything semi-mechanical, they can break. And if something breaks, the most important thing is to try to continue to wear the appliance. Even if the appliance is very loose, merely wearing it in the mouth will prevent much relapse. If the appliance is taken out, the teeth will quickly move and then it cannot be fitted back in again. And as I said, even if it is very loose, it is better to wear it rather than to leave it out. The types of breakage that are most common are principally the little clips around the side of the teeth, which are called clasps. And there are little wires attached to them which grip the tooth so that it stays firmly in the mouth. These are all made out of spring wire, and after a period of time they can fracture. This is much more common if the child is abusing the appliance, either by continually putting it in and out. Some children develop this habit of clicking it in and out all the time, and that is very likely to break the wires. Another reason, if the child constantly takes it out on one side, because that side is easier to take out. That stretches the clasp on the other side, and it is often likely to break. So preferably always remove the appliance with a finger each side to make sure it comes down straight. If the wire breaks, it will need to be repaired by your dentist or orthodontist as soon as possible. But as I said earlier, it's very important that the child continues to wear the appliance. Occasionally, either one of the front wires or one of these little wires to hold the teeth together will break. This is called the catenary wire. These are called the approximating wires, and they do from time to time fracture. There is no hurry. Make an appointment within the next week or two and they can be repaired. It is usually a relatively simple repair. The repair of a clasp nearly always takes an hour or so, and occasionally the appliances have to be sent away to be repaired. The other problem that can occur is with the opening of the screw. If this screw is opened too fast, it is likely to cause the appliance itself to fracture. The reason is, of course, you're making the appliance wider and wider, but the teeth aren't moving as fast. Therefore, when you go to put it in, it breaks like that. It is then almost impossible to wear it, and so a very rapid repair needs to be done with an emergency visit to your dentist or orthodontist as soon as possible. The appliance should be repaired. It's possible to repair it relatively quickly in the surgery, but sometimes with severe damage it has to be sent away. There are other minor breakages which can occur, but essentially the important thing to remember is whatever goes wrong, try to continue to wear the appliance. If it is very, very sore, there is a reason for it, and a very rapid visit to the dentist is really necessary.